Hi learners, welcome back to another mini lesson for the digestive system. This time we're going to look at the stomach and small intestines. Once the food passes from our mouth down our esophagus, it ends up in our stomach. So the stomach has contractions, it mixes up the food with a bunch of digestive juice. It goes through mechanical and chemical digestion in the mouth, and now it's down in the stomach where it gets all mixed up. This picture shows you the different anatomic regions of the stomach, so go ahead and review those. And within the stomach, it goes through more chemical digestion. The cells in the lining of the stomach secrete a bunch of different things to help the process of chemical digestion. Mucin is the first thing it secretes, which combines with other secretions to become mucus. And that helps to continuously lubricate the food as it passes along the GI tract. HCl stands for hydrochloric acid. This helps break up the food into smaller pieces and again continue that chemical digestion to break it down into smaller and smaller pieces as it passes along the digestive tract. It also helps to destroy any pathogens that may have entered your stomach and your digestive tract along with the food that you've eaten. Pepsinogen is a substance that is acted on by hydrochloric acid to form something called pepsin. This is an enzyme that breaks down proteins in the body into amino acids. Intrinsic factor is a substance that is important for the absorption of vitamin B12 in the small intestine. Without B12, we would suffer from a condition called pernicious anemia. And there's several chemical messengers in the stomach. One of those chemical messengers is gastrin, and gastrin stimulates the production of hydrochloric acid and pepsinogen by the stomach and stimulates peristaltic contractions. There's many disorders that can occur in the stomach. Here's a few. So we talked about gastroesophageal reflux disease, or GERD, in the last video. So GERD can affect the esophagus because stomach acids can reflux or backwash up into the esophagus. The stomach acids are very, very acidic, obviously, but how acidic? On the pH scale, they can be somewhere around 1 or 2. So hydrochloric acid, very, very acidic. If you think of the pH scale, 7 being neutral, hydrochloric acid is way down there at around 1. So the reflux disease can be very serious. Vomiting can result from distension or irritation of any part of the digestive tract. The vomiting center in the brain can trigger the vagus nerve to contract the stomach and push its contents up the esophagus and out of the mouth. There's many things that can trigger that vomiting center. It could be stress, it could be a smell, could be many things that will cause the muscles of the stomach to contract and expel the contents forcefully upwards and out of the stomach. Distension or irritation of any part of the digestive tract can lead to vomiting. Gastritis, you should be able to break this term down. Gastro means stomach, itis means irritation. So gastritis is just an irritation or inflammation of the lining of the stomach, and it can produce symptoms like stomach pain, pain in the epigastric area. You can feel full, you can feel nauseous or nauseated. You can have maybe even some bleeding or vomiting. Medications can cause gastritis, especially medications like aspirin or NSAIDs. NSAID stands for non-steroidal anti-inflammatory drugs. Radiation therapy and chemotherapy, alcohol and smoking can all cause gastritis. Treatment includes removing the things that are causing the gastritis if possible, getting off the medicines that are causing the gastritis, and then neutralizing or suppressing the acid in the stomach. Peptic ulcers are caused by increased acidity in the stomach or the duodenum, the first part of the small intestine. So if there's too much acid in the stomach, the protective mucus layer in the stomach starts to wear down, and the acid starts to eat away or erode the mucus lining. So most peptic ulcers are caused by the bacterium Helicobacter pylori, or H. pylori. And that bacterium weakens that protective mucus. So ironically, most peptic ulcers respond to antibiotics that kill that bacterium. Drugs like NSAIDs, again, will increase the incidence of peptic ulcers. The most common symptom of peptic ulcers is dyspepsia, which is another term for heartburn. Pepsi means digestion, dys means bad. So dyspepsia is the medical term for that epigastric pain or heartburn. And again, the symptoms are similar: pain or burning, especially after eating, nausea, vomiting. You can have bleeding from blood vessels that have been eroded. And if untreated, the ulcer can actually perforate the wall of the stomach, and that can be life-threatening. Gastric cancers, these can be asymptomatic for a long period of time, but can cause GI symptoms like indigestion, anorexia, that means loss of appetite, abdominal pain, and weight loss. Men usually suffer with these more than women, but they can be very severe. It can metastasize to lymph nodes, liver, other areas in the abdomen, to the chest, and to the brain. All right, so let's look at some of these suffixes. The ending means it's a noun, it's a structure. The in ending means it's a substance. The ion ending means it is an action or a condition. The gen ending means to produce. And the us ending means pertaining to. All right, so here's some abbreviations. I think we've had this one before. GERD is gastroesophageal reflux disease. H2 blockers, these are types of antacids that we use to reduce stomach acid in treating reflux. So H2 blockers are histamine blockers. NSAIDs, we've had that, non-steroidal anti-inflammatory drugs. And PPIs are proton pump inhibitors, and those are a type of antacids. And then define the following terms. Antacids. Antacids are drugs that reduce the amount of acid in the stomach. Anorexia, I just gave you this term. This one means loss of appetite. Don't confuse anorexia with the condition anorexia nervosa. That's a medical condition. Anorexia, the medical term, simply means loss of appetite. Gastroscope, you should be able to break that term down. Scope means an instrument to view, and gastro means stomach. So a gastroscope is an instrument used to view the inside of the stomach. And pancreas is the internal organ, pancreas. Okay, so let's look at the small intestine. So the small intestine has 4 layers. If you were to take a cross section and look at the 4 layers, going from the innermost layer to the outermost layer. So the mucosa or mucous membrane is the inner layer that's lined with epithelial cells. So these secrete digestive enzymes, and they have supportive connective tissue, and you'll see they have these finger-like projections that are called villi, and they project into the intestine. So lots of surface area there for the digestion to occur. So lots of surface area in there. Now remember, the small intestine is not short. It's very, very long. It's very long, but it's narrow. Right? So the small intestine is smaller diameter, but very, very long. And this is where most of the digestion occurs. Most of the digestion occurs actually in the first about 12 inches of the small intestine. So the innermost layer is the mucosa. The next layer is the submucosa. And this is a thicker connective tissue layer that contains the blood vessels and the lymphatic vessels and the nerves. The next layer is the muscularis layer. So as you can tell by the word, this is a circular layer of smooth muscle. And then it has an outer longitudinal layer of smooth muscle. So there's 2 layers of muscle here, and this is what allows the small intestine to contract and move food along the length. So this is what allows the peristalsis to occur along the length of the small intestine. And then the outermost layer is a thin layer of connective tissue called the serosa. And this is that protective layer. We'll talk a little more about the serosa here in a bit. So the digestive organs all lie within the abdominal cavity. Now go back to, I think it was chapter 3 when we talked about the abdominal cavity. And most of the organs lie within the peritoneum. And the peritoneum is a membrane that encapsulates all of these organs. And there's 2 layers to this peritoneum. The parietal peritoneum lines the whole wall of the abdominal cavity. And then within that parietal peritoneum, all these abdominal organs are lined with the visceral peritoneum. So the organs have like a layer of tissue covering all of them, and that's the visceral peritoneum. The intestines are kind of suspended or hung from the back of the abdominal cavity by a membrane called the mesentery, and it's a continuation of the peritoneum. And there's a big fatty portion of that mesentery called the greater omentum. And the greater omentum is like an apron of fat, a protective layer of fat that hangs in front of the intestines. And that gives us a nice protective fatty cushion in front of our organs. All right, so the three sections of the small intestine are listed right there: the duodenum, the jejunum, and the ileum. So if you want a mnemonic to remember them, you can remember the Dow Jones Industrial, DJI, duodenum, jejunum, and ileum. So the first one is the duodenum, and this is the first 9 to 10 inches of the small intestine. So all the food that's come through the stomach has gone through all of its mushing and mashing with the stomach juice in there. It receives chyme now that the food has gone through a bunch of mushing with hydrochloric acid, and now it's become no longer a food bolus. Now it's called chyme. So the chyme from the stomach enters the duodenum, and now pancreatic juice is secreted into the duodenum along with bile. So the chyme enters the duodenum, pancreatic juice is secreted in there, and bile. And the pancreatic juice also neutralizes some of that stomach juice. Some fats are broken up by the bile acids, and the pancreatic enzymes start taking over the chemical digestion. All right, so all of that's going on in the duodenum. It's a very important site of digestion. Like I said before, most of the chemical digestion occurs in the duodenum. The next part is the jejunum, and most of the bulk of the intestines is the jejunum. It takes up most of the length. So a lot of digestion and absorption. Remember, absorption, go back to that first GI video. Most of the absorption takes place in the jejunum. And then the last part of the small intestine is the ileum. And then the ileum is at the end, and between the ileum and the large intestine is the ileocecal valve. And the ileocecal valve is a sphincter. A sphincter is a circular muscle, and that sphincter controls the entry of the food from the small intestine to the large intestine. So the functions of the small intestine is to mix up the food with the digestive enzymes, to churn it along, to move it along, and to move it from the stomach to the large intestine. All right, so what can happen as the food moves along the small intestines? Of course, infections can happen, right? Of course they can. So gastroenteritis, gastro means stomach, entero means intestine, and itis, of course, means inflammation of. You may, if you have kids or around kids, gastroenteritis is that nausea, vomiting, diarrhea that kids get. It can result in dehydration sometimes, and it can be caused by a variety of viruses and bacteria. We already talked about duodenal ulcers. Those occur in that first portion of the small intestine, in the duodenum. Celiac disease is an allergy to gluten, and this is a protein that can be found in grains, in wheat, rye, barley, certain other grains. Celiac disease damages the small intestine, and it can lead to abdominal symptoms, GI symptoms like swelling, bloating, gas, weight loss, fatigue, weakness, and treatment is to avoid the foods that have gluten in them. Intussusception is not seen very often. Usually you see it in infant boys for some reason. And this occurs when part of the small intestine telescopes or slides into part of the intestine that's next to it. So it looks like it telescopes into the intestine next to it. It's very painful and usually can be cured, believe it or not, with a barium enema. So usually about 80% can be cured or reversed with non-surgical methods. About 20% require surgical intervention, but usually these can be cured with non-surgical intervention. The next one is ileus, and this is a functional problem rather than a structural problem. And this is when the normal peristalsis of the small intestine stops. So the food just backs up and it doesn't go anywhere. We sometimes call this a paralytic ileus. So risk factors include things like surgery, because the anesthesia stops the normal peristalsis, and we'll say the person's bowels just don't wake up. It can also be caused by diabetes, severe forms of diabetes, and also medications like opiates. So the peristalsis stops and the person's bowels just dilate and it doesn't move. So this can, a bowel obstruction can also cause this. So this can be a real problem, and we need the person's bowels to resume peristalsis. If it's caused by a bowel obstruction, then surgery may be required. Otherwise, other interventions can be done. And then finally, cancer. Cancer of the small intestine is not as common as cancers of the large intestine or the colon. They may occur, it may be an adenocarcinoma of the small intestine, but usually when we talk about intestinal cancer, we're talking about cancer of the large intestine. So looking at some word analysis here, this slide is asking you to change the terms into their adjective form. So jejunum would become jejunal, mucosa would become mucosal, peritoneum would become peritoneal, and serosa would become serosal. All right, and that's it for this mini lesson. I thank you for your time and attention, and in the next mini lesson we will look at the liver, the gallbladder, and the pancreas.